Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Pyogenic and the amebic abscess is what we are going to compare in this video. So first, let's just look at the pyogenic abscess. So the pyogenic abscess. So this is seen in age group. So age is greater than 50 years. And next is, what is the male is to female ratio? The male is to female ratio will be 1.5. So it is 1.5 is to 1. Next is to check if it is solitary versus multiple. So is it solitary versus multiple? So the answer here, it is solitary, about 50%. Next is, what about the location? The location, it is present mainly in the right lobe. So pyogenic abscess mainly present in the right lobe. And what about the travel to the endemic area? So travel to the endemic area. So the answer here is no. Then comes the presence of alcohol. The use of alcohol. The use of alcohol is very common in terms of the pyogenic abscess. Next is the most common symptom. So MC symptom. So we have the most common symptom. This is going to be fever with chills. So the individual is going to present with fever along with the chills. Now, what is the most common lab abnormality? So most common lab abnormality, this will be nothing but the elevated ALP. So there's increase in the significant ALP. Now, what about jaundice? So is there presence of jaundice and elevated bilirubin? So there's jaundice with elevated bilirubin. So how about its presence? So it is very much common, it is more common. Now, how do you diagnose this? So diagnosis will be by, diagnosis here is nothing but by the positive BC, that is a blood culture. Now on the other hand, we'll dive into the amebic abscess. So amebic abscess, it is, what is the age group? The age group of the amebic abscess, it is in 20 to 40 years. Then comes a question on the male is to female ratio. The male is to female ratio is nothing but 10 is to 1. Now, is it solitary or it is multiple? Solitary versus multiple, it is solitary. And this is about 80%. Solitary was 80%, whereas in pyogenic, it was solitary 50%. Next is, what about the location? The location is nothing but it is right lobe. Location is in the right lobe. Then travel to the endemic areas. What about the travel? So travel to the endemic areas, it is yes. Answer is yes. Then what about alcohol? Alcohol also, it is very common. It is common. Then what is the most common symptom? Most common symptom will be abdominal pain. So there is abdominal pain is the most common symptom. Then what is the most common lab abnormalities? Most common lab abnormality is going to be the elevated ALP. Elevated ALP, that is increase in the ALP. Then jaundice. Next we have the jaundice. So jaundice and the elevated bilirubin. So jaundice and the elevated bilirubin, this is less common. Whereas in terms of pyogenic abscess, the jaundice and the elevated bilirubin was more common. Then lastly, let's look at how to diagnose. The diagnosis is by the positive anti-amebic antibodies. So in terms of pyogenic abscess, we saw the positive blood culture. Here it is positive anti-amebic antibodies. To learn and grow daily like this, please do subscribe.